You're listening to Out of the Box with Rosie Tran. Out of the Box is sponsored by hugmetees.com. Spread love, give a hug, hugmetees.com. Guys, we are now on SoundCloud. Check out soundcloud.com and look for Out of the Box podcast. We are excited about our new followers, and we hope that you guys will join us over on SoundCloud if you're a SoundCloud subscriber. And I just want to give a shout out to the two new reviews on iTunes. I have been begging and pleading for positive reviews, and I am really excited. Thank you to those people who recently went on and left some positive reviews. Also, there's been some positive ratings, but the reviews help us out a lot more. So thank you to those people who went on there this week and left some positive reviews. I'm really excited about that. And I'm excited about our guest today. He is a doctor and has a new book out called Doctor, the Disillusionment of the American Physician. This is his sophomore book. It's a New York Times bestseller. His first freshman book was called Intern, also about his experiences in the medical industry. Dr. Sandeep Jauhar, how are you today?
I'm great, thanks.
I am really excited to have you on here because you definitely had a lot of interesting things. Were you nervous about writing this second book and having all these juicy details about the medical industry out there with your name on it?
Well, maybe a little, but the way the book came about is, my first book was a memoir of my medical residency. It's sort of my initiation into the medical profession, and that was called Intern. And then it was a few years. I started as a doctor. I actually became a cardiologist. Actually got my first job 19 years after I graduated from high school. So I'd been, in a really long training, and I was looking forward to starting my job, um, and then things didn't exactly work out the way I had hoped for. I found that doctors were really unhappy, and I myself became really unhappy in the first few years of my actual job, my first position as a cardiologist. And so I sort of hit a point that was as close to bottom as I really want to get. And so at some level, I just didn't really care what people thought. It was just something I had to get off my chest. And I think that a lot of people do see the flaws in the American medical system. And so, it's like, I wasn't telling people anything that they didn't already sort of intuit. But, putting my name on it and sort of reporting a lot of the just nastiness in the system, and really, in some cases, just outright fraud that occurs was, it gave me some pause, obviously, but it was something that I just felt like I had to do.
That is really brave, and I'm very happy that you've done that because I don't think enough people speak out. So many people are scared to speak out, and sometimes there are real repercussions. We had a whistleblower on the show recently that was going against big corporate banks, and he definitely was scared of losing his job and some of the negative repercussions. But I think that these things and your desire to explain what's going on is just really important for the average person to know. Now, you talked about a low level of satisfaction with a lot of doctors. And, I know there's kind of a stereotype already of doctors working these long hours and doing it, and in hospitals for hours and these long shifts, and the same thing within nursing. But there's this kind of idea that doctors are doing it because they love it, they care about the patients, they're passionate. And you're saying that it was hard to be a passionate and ethical doctor in the society that we have right now.
Yeah. You know, Doctors are unhappy for a lot of different reasons. And some of it has to do with why other professionals are unhappy, like teachers or lawyers, or, there are a whole host of professions that used to have it pretty good. And because of corporate restrictions and a sort of business mindedness that has creeped into the profession, there are a lot of professionals who are pretty unhappy. I mean, teachers are one of, or teaching is one profession that has really undergone seismic shifts, with changes in how teachers are evaluated and measured, and all the testing that's going on, and the different metrics that the teachers have to have to meet. And doctors are the same way. But that's sort of just one piece of it. One piece of it is that there's changes in the medical industry that have nothing, that are not coming from doctors. They're coming from insurers or the government or whatever, that are resulting in changes that are making doctors feel overwhelmed. There's the paperwork. There's the increase in malpractice, liability pressures, and there's a whole host of things. But the biggest thing that I realized, and this was the thing that really affected me the most, and I think really affected my colleagues the most, that it was almost an existential crisis. It wasn't so much that we had more paperwork or more this or that. It wasn't sort of something tangible. It was that the system wasn't allowing us to be passionate about our patients. That wasn't the case for me. And I went into it because a girlfriend got really sick when I was in college, and it introduced me to the idea of becoming a doctor. And I was also interested in human physiology. Those are sort of good reasons, I think, for wanting to become a doctor. Making money is not a good reason, and if you do it for that reason, you're going to be unhappy. But most doctors don't do it for that. They do it because they really genuinely wanted to help people. And the system today is structured that it makes it harder and harder for doctors to do that. So the biggest reason why doctors are dissatisfied is not because they're making less money or they have too much paperwork or people are suing them. It's because they can't be the kind of doctor they want to be.
I want to bring up something very important that you brought up, because I think the teaching metaphor is a really good metaphor for people to understand, because medicine seems very complicated, but teaching is pretty simple. So what's going on, for those of you who don't know, in the teaching profession, is that there's this bombardment of standardized testing, and teachers feel that they can't really teach kids because they're forced to meet these testing limits. Now, with medicine, you're saying that the corporatization of the medical field, you guys have to meet certain numbers. Is that right? Certain overhead and certain corporate numbers, and it's all about the numbers more than the patient care. Just like in teaching, it's more about the numbers instead of giving the kids the actual education. Is that what you're saying?
Yeah, and I'm saying that some of the reasons for the numbers, in some world, make sense. Let me give you one example. Just like in teaching, right? It makes sense to encourage teachers to do a good job so that their students do well on standardized tests and can get into good colleges. I mean, that sort of makes sense. But the way that the corporate system demands it forces teachers to do things that they're not comfortable with, like teaching to the test, and
Instead of the whole picture.
Some of the high schools around here, they have like specific classes where students are just getting trained in taking the SAT rather than providing a good general education that will then result in good testing scores. So in medicine, we know that there's some drugs that you should give patients because it helps them live longer. But it turns out that for one of the one example is an ACE inhibitor drug you should give to patients with heart failure. But it turns out that only about 2/3 of physicians prescribe those drugs. Why? Because doctors are too busy, they forget, they're not, they're fallible human beings. So it makes perfect sense to try to get doctors to prescribe ACE inhibitors more to heart failure patients because it'll help them live longer. But what the corporate system does is it demands that doctors prescribe these drugs, and they get dinged for not prescribing the drugs. They get penalties or they get less reimbursement, and so it hits them in the pocketbook. So what doctors then turn around and do is say, you know what, every single patient I see is going to get an ACE inhibitor, and I don't care if the patient has kidney trouble that might make prescribing an ACE inhibitor not such a good idea. I don't want to document that they have this exception to getting an ACE inhibitor, or some little old lady who maybe is on 20 different medications, and normally I would not think about starting the ACE inhibitor. Well, I don't care. I'm just going to start it. And so they feel like they're being forced uh, to to do these things that don't really make sense, and they're sort of, their autonomy is being taken away, and that's the same for teachers. They're not being allowed to create their own lesson plans. They're being forced to teach to the test, and lawyers have their own problems. So this is part and parcel, I think, of a big change in American society, where previously respected professionals are just getting screwed by the corporate system.
I want to talk about something you mentioned because I think the average person has quite a different stereotype, and you're not the first doctor I've spoken to who said this about the pay. So you talk about struggling to make ends meet as a doctor, and I think a lot of people have a stereotype that doctors are extremely wealthy, they're making all this money, and you talk about, well, maybe in specialized fields, but a general practitioner is having a hard time to pay his bills. And is this because a lot of money is going to insurance companies? Where is all this money going when people are going to the hospital and they're getting these $20,000 bills?
It's going to insurance companies, it's going to insurance executives, it's going to hospital executives. I mean, people are paying more and more for healthcare, but less and less of that money is actually going to doctors. In fact, doctors' salaries only make up somewhere between 10 and 20% of the healthcare budget. Okay, 80% to 90% is going somewhere else. It's not to doctors. Now, look, uh, you know, doctors, even primary care physicians, they do better than most people. I mean, no one's going to argue that doctors are poor, or they're going to, they're suffering financially. But let me just give you just an example, just an idea, so your listeners can get some idea. Someone who's in primary care, if they see 20 patients every single day, 6 days a week, okay? Now, seeing 20 patients is not easy. I mean, you can imagine, okay? So 20 patients every single day, and to fit those 20 patients in is like, maybe 10 minutes, 12 minutes a patient, okay? And then all the paperwork associated with that care, okay? The way the reimbursement is, that doctor, after paying overhead, might be making something like 100, and like a low hundred, maybe like $120,000.
And this is
Okay,
working very long hours.
working 20 hours, 20 patients a day, 6 days a week, and taking 4 weeks off a year for vacation. Okay, so $120,000 is nothing to scoff at. But then you add the fact that they're paying maybe $20,000 a year in malpractice insurance. So you take that off, and then you add their loans from medical school.
Student
A
loans,
lot of
which
medical
sometimes
students,
are 300,000 plus leaving medical school.
more, sometimes more. I mean, I know people who have 400,000 plus. You add college, and you're looking at sometimes $500,000 that they're in debt. Okay, and then you add, and then obviously, taxes and everything. So at the end of the day, you end up with, after you pay your loans, you end up with a fairly small amount for the amount of work you had to do. It's not going to put you in the poorhouse, but it's certainly not the vision that most people have of doctors, like strolling around the golf course,
Yes.
and and having, going to, multiple vacations and having a home in Florida.
I guess I just want to make it clear to people, because a lot of people think that they're increasing hospital bills and their increasing medical bills are going towards the medical professionals that are serving them, and I wanted to make a distinction that it's not going towards you guys.
No, it's going to drug companies. It's going to drug company executives. It's going to insurance company executives. It's going to hospital executives. Some of whom are doctors, but a lot of them are just MBAs.
Hmm. So
You
there
know,
is. Has Obamacare helped this system anymore? Is it making it worse?
you know, I don't think that Obamacare has done enough to change the system to cut down on um, the number one, the waste, and also where all the money is going. Obamacare could have done a lot better job in allowing Medicare to negotiate drug prices. I don't think we need more billions and billions of dollars going to the pharmaceutical industry. I mean, they need obviously some money to recoup their investments and continue to produce good drugs, but do they need the outlandish profits that they're making? I don't think so.
So, what if you had a private practice and you were able to see clients the way you want? Do you think that you would go broke? And I'm saying this because I recently experienced exactly what you're talking about. I had a simple ear infection and I went to the doctor. I was seen for less than 2 minutes and I was actually misdiagnosed with a sinus infection. And it took 6 months to cure what could have been cured in a week because I was kept having to go back. And the wait list at my hospital were so long, it actually took 2 months to get another appointment, and then 2 months after that to get an appointment with an ear, throat, nose specialist. And
Yeah.
I was it was something very simple, just an ear infection. So I mean, that was my experience from hell. But can a doctor be ethical in the system and say, hey, I'm going to see patients for 30 minutes, an hour, and take my time and get to know them the way it was, back in the day? Is that even
Yeah.
physically, feasibly possible in our current system?
Well, I mean, um, a lot of my colleagues joke if you're independently wealthy, you know,
Okay.
you know, you know what I mean? I mean, if you're not doing doctoring to earn a living,
Then you
but
can
I
do
mean,
it ethically.
consider it. I mean, consider what I just said. The doctor who saw 20 patients 6 hours, 6 days a week, primary care, seeing a moderately sick population, not super sick, not very mildly sick, moderately sick. So they're getting sort of moderate reimbursement per patient. Talking like 120 to 130 $1,000 a year. Now, if you see patients for a new patient or a follow up for half an hour or a new patient for an hour, then you're not going to be able to see more than about, what, 10 patients a day. So cut that revenue, in half. So and then you ask yourself, are you going to be able to pay off your loans and save for your kids' college and whatever? I mean, look, I'm not trying to argue that doctors are, I'm not trying to, play a violin for doctors. That's not my goal. But
You're just saying
it's
it's not
just
what
to
it used to be.
illustrate it's not what it used to be, and what ends up happening is that doctors end up running on a treadmill because no one wants to, everyone wants to, earn a good living. So they end up running on a treadmill, seeing patients every 6 minutes, 8 minutes, and then someone comes in with an ear infection, and they don't take the time to look in the ear and do the right thing, and because they're rushed, and so the patient ends up with a problem that could have been fixed that lasts for 6 months, like you
Is
know.
it
It-
uncommon what happened to me? Because I was just totally shocked. And
no, it's oh my God, it's not uncommon. This happens this happens all the time. Every you know, this happens every day. Um, that because of a lack of time, there's a misdiagnosis. This is common, and this is why you remember the pre-meds in college, right? I remember them. I wasn't a pre-med in college. I ended up studying physics, and then I went back to medicine later. But the pre-meds in college, they were like perfectionists. They did well in school. They were like focused and whatever. And you take those people, and they have this vision of what they want to do with their careers, and then you put them in a situation where they're constantly making mistakes because they don't have enough time to see their patients, how do you think they're going to react? They're going to be miserable because they're perfectionists to begin with.
You're taking people that are passionate, caring, perfectionists, probably top of their class, wanting to do something positive for the world, and they're put into, it's kind of like a round hole in a square peg. It doesn't fit.
Yeah, it doesn't fit.
I want to talk about your time speaking as promoting a pharmaceutical drug. You talk about this as you were very
Hmm.
concerned about some of the effects of the drug, and you were doing this for extra money because you weren't making
Yep.
enough money. Um,
Yep.
I mean, what was that like? What were you just you know felt like you were stuck between a rock and a hard place? You're here out there promoting, giving your name to this drug, yet it has these possible negative side effects that can really hurt people.
Well, I mean, it was a drug that that I believed in. I prescribed to my patients,
So at the
but
time, you
the
did believe in
whole
it at first.
oh yeah, oh yeah, I totally. I mean, I would never speak for a drug that I didn't believe in, um, but you know, the whole experience was just a little gross. It wasn't exactly what I think of as a professional experience. Where I mean, first of all, I was speaking about this drug. Um, no drug is 100% perfect, right? There's always going to be some issues with it. So I wanted to present those issues in a balanced way, but the company wouldn't let that. They said you have to use our slides. Um, and you know, I eventually sort of managed to convince them to allow me to use my own slides. Um, but it was a lot of like negotiating back and forth. Um, so in the end, I sort of felt like I was just peddling a drug rather than presenting a balanced view of the drug. And even though it was a drug I prescribed to my patients, I believed in.
But you wanted to give the
um,
whole story.
I wanted to give the whole story, and then, but it's like, uh, it was just like a trip uh, through a public toilet. It was just, it just left me feeling like this is just gross. This is not what I want to, where I want to be. And then eventually, um, I stopped it.
It sounds like they
When
were kind of using you as like more of a salesman than actually a medical professional.
But pharmaceutical companies do this all the time with doctors and doctors who are sort of struggling to pay back loans and this and that. Some of them make those compromises, and I made that compromise for about I don't know, maybe a year. Um, but then when the data came out that suggested that the drug was not as beneficial as I thought it was, I stopped it. I said I couldn't do it anymore, even though the pay was still there, even though they were still paying money, and they still wanted me, but I was like, this is I can't I don't want to do this, and uh, that along with a lot of other stuff, um, starting to work in a colleague's private practice and seeing how he practiced, it just led to a deepening disillusionment with the profession I had entered, and it got to a point where I sort of felt like I was like in a midlife crisis, and was really down and really depressed about the whole thing, and it got to a point where you asked me, did I care about what people were going to say? When you hit a certain point, you just don't give a shit, and that's how I felt.
No, that's great. I want to
Yeah.
talk about your time working in your colleague's office. You were working in this office where this doctor was prescribing these excessive procedures, these stress tests, and
Yeah.
you talk about um, it. The stress tests were a highly billable procedure, whereas just a doctor's visit to the doctor's office wasn't that lucrative. So it's kind of like
Right.
a pay to play type thing where people are being prescribed excessive things that aren't really helping them, and that can be scary when you're dealing with someone's health.
Absolutely. And I started working with this guy, and he had a mill of patients who were coming in and getting all these tests, these ultrasounds, and these stress tests, and I wasn't prescribing these tests. I wasn't saying, okay, you need to have a stress test. If I would see a patient, I would say much more often than not, you don't need a stress test. You're fine. Go home. But he was ordering these tests, and I just felt like I was a part of it, even because I was just working in the office, and even though I wasn't ordering the tests, um, I was there, part of that practice, doing this moonlighting, and it just made me feel really dirty, and that was probably the biggest force that pushed me into this crisis, and then it just occurred to me that this crisis was sort of emblematic of the midlife crisis of American medicine. It was it was the same story.
Do you think that what he was doing is rare, that he's just a corrupt doctor, or do you think that this is something that is just a regular practice that happens in offices and medical, hospitals and places all across the US on a regular basis?
I think it happens on a regular basis. I think the reasons are sometimes different. Um, for some doctors, the reason they order a lot of tests is because they don't want, they feel that ordering a bunch of tests means they won't be sued. They don't have any time. You know, you come in with an earache, and they just don't have the time or the energy or whatever it is to look in the ear, properly examine you, think about what's going on. So they'll just like say, okay, just get a CAT scan of your ear or something, um, or get an MRI, make sure you don't have XYZ that they know you don't have and you know you don't have, but it's like, okay, just do it. It's just part of the culture, just do it. And then there are some doctors who do it because they know they'll make more money by doing extra tests. And are they the majority? No. Are they a impossibly small minority? No. There's somewhere in between.
Let's talk about the excessive procedures and lawsuits, because you mentioned um, that there's a fear of lawsuits, and sometimes I actually worked in a hospital when I was a teenager. I was just a volunteer candy striper, and there was time that I spent in the legal department of the hospital I was working in, and there was a whole legal department. I don't know if this is a commonplace in other hospitals, but they had all these files of information for potential lawsuits or for lawsuits that had happened. And a lot of times you don't really hear about that side of medicine. Are you guys regularly getting sued? Is there this constant fear of lawsuits? I just remember, very briefly, and then I heard you mention it and also have read about it, that it's a big fear. Are doctors personally liable? Can they push the blame on what the institution that's kind of forcing them to behave this way? Are you guys having all of the liability if something goes wrong?
I think in the end, the doctor has the liability. If the insurance company says, no, we're not going to approve this test for what XYZ reason, and the doctor then doesn't go to fight for it, um, and then the patient ends up having a tumor, the insurance company that didn't allow the CAT scan that the doctor wanted to get won't be sued. The doctor is going to be sued because they they didn't get the test. So, I mean, that's sort of a rough. I mean, obviously there are exceptions, but that's sort of um, the, the the rough way of looking at it. That we are doctors are liable um, for insurance company decisions, and the insurance company will tell you this is not a medical decision. This is a decision based on coverage or whatever. So they sort of exonerate themselves from any liability by saying that. Now, do doctors get sued? Yeah, they do. They get sued quite frequently. In fact, I'm a cardiologist. Um, Roughly 20% of cardiologists are sued every year.
Wow, that's a really huge number.
So you're talking about there's a 1 in 5 chance of being sued every year. So you're talking about every 5 years on average, every cardiologist is going to be sued. Now, all those suits don't necessarily go to court. All those suits don't necessarily result in a judgment, but there is that lingering fear. Um, and OBGYNs are another specialist that very frequently get sued. Neurosurgeons also, and and the malpractice premiums are so high now because of so many lawsuits, and a lot of the lawsuits are not. There are certain doctors who seem to get sued all the time. So a lot of the reason the premiums are increased is because to defend those doctors who are getting sued multiple times. So, it's very frustrating for the rest of us who are trying to do a good job and or, very rarely, litigated against.
So what do you think is the solution to this problem? What would you recommend to help change the system for the better? To enact change that's going to actually help patients and help doctors and not create this kind of giant machine that just keeps going and going.
There's no simple solution. That is that's something I'm pretty sure about after thinking about this for a pretty long time. Um, because we can't reinvent the system. We have to work with the system that we have. Um, if you were to start the system all over again, you might want to go to a single payer system where the government is in charge and is negotiating prices, and there's less paperwork. Now you have multiple different insurance companies, and they all have their own systems, and it's just a big mess. So there's no simple solution. But I think one thing that I believe would be a good thing is having more and more doctors just be salaried and not be working for in a fee for service system that rewards doctors for doing more and more stuff. Now, I mean, I work in a hospital where I get a salary, and I get that salary pretty much regardless of whether I order 20 tests or order 2 tests. So when you take that financial incentive away, I think then the doctors start practicing in the way that they want to practice, the way that's right, and all the other pressures and incentives, at least they're still there, but some of them are taken away. I mean, the liability pressure is still there, but the financial incentive to just do more and more and more is
For no
taken
reason,
away.
right?
Yeah, yeah, exactly.
Okay, I want to talk about preventative care because you talked a lot about ordering these tests once people are sick already. And I think I read a statistic that the majority of chronic illnesses can be prevented by preventative care. And I don't really hear that word that much when it comes to the medical industry these days.
Yeah, it doesn't pay to do preventative care. I mean, that's another.
Do you think the system wants people sick in a way? I mean, not you, obviously, and doctors who care about people, but the insurance companies, the pharma companies.
I don't think the insurance companies want people sick. I think the pharma companies, they're. I'm not gonna. I can't get into their minds, but clearly they make money when people are sick and take their medications. Um, you know, I mean, even doctors, if you're a surgeon, you're paid handsomely for doing an operation. Um, you're not paid. You're paid, next to nothing comparatively to spend an hour with the patient discussing the risks and benefits and eventually maybe talking them out of the operation because it's not in their best interest. You're not paid anything for that. Um, most doctors are paid nothing for advising their patients to, exercise and stop smoking and whatever, but they are paid to see the patients once they develop emphysema and see them over and over and over again. Um, and the oxygen company is paid for bringing tanks to the patient as soon as they develop emphysema, and drug companies are paid for giving inhalers to the patients. But that first step, is preventing the disease. There's very little in it for anyone in the system
To be
to spend a lot of
healthy.
time doing that. Yeah, except maybe the patients.
Yeah. Um, I want to ask you a question that I am just personally curious about. I know growing up, I had the same doctor for years and years and years, and he knew me pretty well, my pediatrician. And also, I had an OBGYN for many, many years. And I noticed that there's been a shift from that doctor patient relationship. Um, and I'm not sure what's caused it because it seems like, and I know you're saying that doctors are really rushed and they don't have time to see patients, but I just feel like there's been a shift from that one-on-one doctor relationship of someone knowing you your whole life to it seems more casual, almost like you're just going to a fast food restaurant or something. I don't know
Yeah.
if it's me as an adult not taking time to go and find a doctor that I can see, but it just seems like everyone I know, they don't really have a primary care physician. It's just whoever their insurance or random. It doesn't seem like there's that relationship anymore.
Yeah. I mean, if you try to get a primary physician appointment in some parts of this country, you may have to wait 3 months because people don't want to do primary care because you have to see 20 patients every day, 6 days a week, you know, to 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 make the kind of salary we've been talking about, and then you're saddled with all these loans. So people don't want to do primary care; they want to do the more lucrative specialties, um, and the primary care doctors, because the reimbursement is so relatively low, they're seeing packing more and more patients into their schedules, and then they just don't have time to develop a relationship with the patient. So that old time doctor patient relationship is virtually gone. I mean, you just don't see it. Um, I mean, maybe some doctors who are doing concierge medicine that where they don't accept insurance and they just get paid directly, and they can afford to spend more time with the patients, but that's not a solution for most patients. That's just a solution for well-heeled patients.
Is that an option to just not have insurance and do a pay? I remember doing that as a little girl, but it just seems like insurance has gotten just bigger and bigger and bigger. I remember we actually had a
Yeah.
family doctor. My parents are Vietnamese immigrants, and he was a Vietnamese
Hmm.
doctor that, he catered to the immigrant community. And we just paid him. Like, I don't even remember having insurance, or if we did have insurance
Yeah.
until later. Is that even an option
Yeah.
these days to just have reasonable rates, not marked up for insurance, and just go to a doctor?
I mean, some doctors don't accept insurance, and some of them say it's because they don't want to deal with insurance companies, and they want the patient to pay them directly, and they charge a rate that's probably typically above what an insurance company pays, but then they have more time to spend with the patient. They're not constantly looking at the clock. In some cases, that's better for the patients. But if you can't afford your premiums as a patient, your insurance premiums, you're not going to afford these doctors who are typically charging more than what an insurance company would pay. So, I don't. It's not a solution for. It's not a solution out of the mess. It's just a solution for people who have the money to pay for the extra time and the extra care.
But
Um,
I get what you're saying, but aren't the prices from insurance companies marked up to cover all their costs? I guess what I'm asking
the
is I went to a
Yeah.
chiropractor and I was in a car accident and I went to a chiropractor and they were going to charge me an insane amount because they were assuming that the other insurance from the other person who hit me was going to pay for it, and it ended up not the claim didn't go through, and I was left with this huge chiropractor bill. I know that's not a doctor, but and I told them, hey, I can't pay this, and they said, okay, we'll give you the cash price, and they just gave me like a way it was like 80% reduced, and I know that
Yeah.
that's happened before with other medical things, not with me personally, but
Yeah.
um, there seems to be these
Well,
two systems, and
yeah.
that's happened with me
Well,
with dental work.
what providers charge the insurance company is not necessarily what they get from the insurance company. They may charge an outlandish price, and the insurance company marks it down and discounts the price, sometimes to 10% of what they're asking.
Oh wow. Okay.
Um, so it's not necessarily that you would end up paying that amount, but um, you know, insurance companies charge high premiums, and they pay out those premiums to doctors who see the patients, and whatever's extra they keep for themselves. And there is usually a big differential between those two numbers, and there's usually a significant amount of profit, especially in recent years, for most insurance companies. So, you know, I mean, I guess one thing you're saying is, well, why pay those premiums? Just pay the doctor directly. Some people say some people want to do that. They think that's the best way to do it, because when you're not when you're paying the doctor directly, you're more apt to shop for, you know, comparison shop and do the best, like you would comparing, cars or whatever. Um, and that makes sense to some degree, but then there's also a big component of healthcare which is just catastrophic care, where you can't really do any comparison shopping and you can't pay out of pocket. Like being in the hospital is like $3,000 a day. You spend 3 days in the hospital, that's $10,000. You have to have insurance for that. But maybe for like more elective, sort of preventative care, maybe it makes sense to have, a system where people just pay the doctor directly and just don't go to, just don't go to the insurance company. Don't pay the insurance company. I mean, that is one way to do it, and that's what a lot of people on the right, like Republicans, are saying, that reserve insurance just for catastrophic care and get rid of it for elective care. Just like for the earache or just going to see the doctor for just a sore throat or whatever.
You talk a lot about the paperwork. There's so much paperwork. And I actually have a friend who was an orthopedic surgeon, and he left the medical industry because he said he felt like he was spending so much time filling out paperwork and barely any time dealing with patients. And that's the reason he got into medicine, because he wanted to deal with patients. Is this
hmm
is this paperwork just legal paperwork, or is it paperwork to actually get paid from the insurance companies?
Well, it's both. I mean, there's paperwork, there's increased documentation, um, so that you can get paid, and then after you submit the bill, there's often paperwork to um, ensure that you get reimbursed for for the work that you've done. So the paperwork is just enormous. In fact, um, in in the United States, I, I have all the numbers in the book. I can't remember right off the top of my head, but doctors pay office staff something like $60,000 a year just to handle paperwork.
So let's
They have to
say,
hire.
I'm sorry to cut you off.
Yeah.
Let's just say that you're with a patient for 10 minutes. How much paperwork is incongruent with that? Is it 10 minutes of paperwork, or is it like half an hour of paperwork per 10 minutes?
Well, it's writing a note. It's then there's a lot of extra stuff that happens afterwards. You order a test, the insurance company says no, then you have to call and argue. Um, you've got to call the insurance company and argue why you prescribed this drug over that drug, and then you're talking to someone who doesn't necessarily know why, and they don't have medical training. So then you have to write a letter to the medical director to justify this drug over that drug, or why you were doing this test. And a lot of that can be done by office staff. And in my practice, it doesn't really, a lot of it doesn't come to me, but some of it does. Sometimes they say, look, they're saying they're not going to approve this echocardiogram. You have to call and explain exactly why you're doing it, and that conversation can take 15 minutes. And or you call and there's no one available. They keep you on hold. So on average, I would say the amount of paperwork and administrative duties it's probably something roughly, um, you know, half your day, or maybe a third of your day
That's a
is
lot.
doing that.
That is a
Yeah.
lot. Um, Now, you talk about how, our country has some of the best medicine for, rare diseases, Ebola, other things like that. But chronic diseases like diabetes and other things like that, sometimes it's uncoordinated. So, what
Mhm.
exactly does that mean? Is it like the right hand's not talking to the left, or this person's seeing multiple doctors and they're not communicating clearly, or the insurance isn't communicating? What does that mean?
It means that, you know, you used to have one doctor, who could sort of coordinate your care, who is in charge of your case. Now you have multiple doctors. Um, I mean, part of it is that medicine has become more complex. No one doctor knows everything, like maybe they did in the 1940s or something. But now, it's become so technological and so complex that you have people who are just handling like small aspects. Even in like my area, like I'm a heart specialist, but then within the heart there's like the electrical system, and then there's cardiologists who just specialize in the electrical system, and other cardiologists who just specialize in the coronary arteries. And so you have so many more doctors than you ever used to have, and they don't talk to each other because they have so little time to discuss uh, their cases with the other doctors on the case. So they end up making decisions that are sometimes in contradiction to other doctors, and it's sort of back and forth. I mean, I can't tell you how many times this happens with my patients, where I have patients with heart failure who need to take water pills to keep the fluid out of their lungs, but they'll go to their kidney doctor who says, "Oh, no, no, stop the water pill because it's irritating your kidneys." Well, you know what? We know that already. Instead of someone picking up the phone and telling you that they're going to stop the diuretics or the water pill, so you can tell them don't do that, they just make the decision, and then the patient ends up stopping it, and then they end up in the hospital because they have fluid throughout their lungs, and then you have to uh, uh, correct the situation. And it's like this back and forth. It's very uncoordinated when you have care that is so hyper specialized.
So,
And
do you think hyperspecialization is a bad thing because of the fact that um, people can't? I mean, you're a specialist, but because people can't, get the whole picture, basically.
yeah, I mean, hyper specialization in and of itself is not a bad thing, but it's bad when the specialists aren't talking, and it's bad when there isn't someone who's helping to coordinate the care. A specialist should make a recommendation, and the primary doctor, the one who's on the case, who knows the patient the best, knows the patient's values, and knows the patient from childhood, say, should be able to say, you know what, I understand your recommendation that the patient should have surgery. I know this patient. I don't think this patient will do well with surgery. I know this patient's values. I've spoken to the patient, and so I'm going to reject that recommendation. But if you don't have someone who's kind of like
Like on your side,
the
right?
on your side, the quarterback, this is who's helping to coordinate everything, then then the patients end up having to make those decisions. And then I'll have patients come in the office say, "Well, this doctor said have surgery, and this other doctor said don't have it, and I have no idea what to do." And they ask me to make the decision. Well, I have no idea what to do. Um, you know, that's where hyper specialization becomes very counterproductive.
I see. I notice a lot of doctors are moving towards a mix of East and Western medicine. I don't know if that's a trend or a fad, or because a lot of people seem to be a little bit disillusioned with the big pharma. What's your opinion on this? Do you know what I'm talking about? How some doctors are moving more towards a mix of both, but sometimes a lot of Eastern medicine isn't covered by traditional insurance.
Yeah, um, I don't know a lot about Eastern medicine or Ayurvedic medicine or so it's not really my area. I mean, I know that some doctors do practice various things, herbal medicine. Some practice homeopathic medicine, acupuncture. I mean, there's a big industry for that, for so-called alternative or complementary medicine. But it's not something that I practice, so I can't really comment on it.
Okay. Well, we know why you wrote this book because you were feeling, as the title says, disillusioned, and you wanted to get your story out there. But this isn't your first book. This is actually your sophomore book. Your first book, Intern, which was out a couple years before that. What made you decide to get into becoming an author from being a doctor?
Yeah, I was always interested in writing, but I grew up with immigrant Indian parents who had no clue to what that meant for my eventual livelihood. My dad would my dad would say non-science is nonsense,
Okay.
um, and he wanted me to become a doctor. And then when I said no initially, he said, well, you do something, where you can make a living, and writing wasn't going to do that. So I ended up studying physics. I went to physics graduate school. I was at Berkeley. And then eventually, as I had mentioned, my very close girlfriend got sick, and then I started to get more, attracted to medicine through that whole experience. And then I decided to go to medical school. Um, but I was always interested in writing, and it was something that I just remember being attracted to even when I was a kid. And then when I finally um, got into medical school, I applied just on a lark for a science journalism fellowship, and I just wrote an essay, and I applied, and about maybe 10 people got it in the country, and about 250 people applied, and I didn't think I was going to get it. I just wrote the essay, and I just figured whatever happens, and I got it, and they sent me to Time Magazine. So I spent a summer at Time Magazine before I went to medical school, and I got bitten by
the juices were flowing.
Yeah, exactly. And then I write about this whole experience in my first book, Intern. But then that whole thing, when I left Time Magazine, I asked them for some names of people I could call on in the future, and then I got a name of someone at the New York Times, and then I basically barged into his office of one of the top editors when I was in medical school, and asked if I could write for them, and the guy thought I was crazy and told me to go away and never come back, basically. But I started writing. I went to Washington University in St. Louis for medical school, and I started writing for the St. Louis Post-Dispatch when I was in medical school, and then I sent my stuff to the New York Times, and eventually when I came to New York City to do my internship in residency, I had a small portfolio of articles I had written as a medical student, and the Times was interested, and they gave me this option to write about my residency, and I started doing that, and that led to the book Intern.
So is your dad still with us, or has he?
Yes,
He is. So how
yes,
does he feel now that you're a New York Times bestselling author, and that's what you always wanted, was to be a writer, and you kind of got both worlds. You're a doctor and a writer.
yeah. He has like a lot of parents. He has this revisionist history. He's like, aren't you glad I encouraged you to become, to go to medical school and then to write about medicine? I'm like, I don't remember that, Dad. I don't remember you ever encouraging me to write. He's like, well, it was for your own good, but I knew you were going to write anyway. Uh, and aren't you glad you have a profession to fall back on? And I'm like, yeah, all right, fine, whatever.
That is
Uh,
so funny that you said that. My mom has the same revisionist history. She's like, "Oh, remember when I used to take you to go do this and that? I was always
yeah,
supportive of you doing whatever you want." I said, "I don't remember that."
yeah, I remember that. Exactly, exactly. So true.
Well, so where can people find your book? Where can people find you online? How can people connect with you, buy the book?
So you can the book is called Doctored, um, The Disillusionment of an American Physician, and you can get that on Amazon or in most bookstores. And the first book is called Intern: A Doctor's Initiation, and you can get that on Amazon also. Um, and it's still available in most bookstores I go to. I'll sometimes I'll
You'll check
check
it
in.
out, right?
I'll have a copy. I'm like, okay, that's good. Um, and you could, I'm on Twitter. I think you and I are followers. I'm at S Jauhar, Sjauhar. Um, or you can just email me, or send me a message on Twitter or whatever. But I love to hear from readers, and I do respond to every email I get. So I'd love for your listeners to um, give the book a chance, read it, and tell me what they think.
Yeah, guys. So go on Amazon and check out the book, and also on outoftheboxpodcast.com. We will have links to his Twitter and also his book on Amazon, so you guys can go ahead and buy that. One more question. So you said you kind of hit rock bottom and you were just willing to just write about anything and you didn't care who read it. Now, is most of the feedback from other doctors like a high five, like, yeah, man, you tell it? Or are people kind of like, hey, shut up, don't tell everyone, all this bad stuff about our industry? Like, what's been the feedback from your colleagues?
It's been a mix. Um, some some doctors are like, hey, you know, uh, what the hell are you doing? I mean, this is crazy, or will say that I overstate the problem. Um, Other doctors, I walked out of the O-bomb pen at the hospital, and two doctors actually applauded, which never ever happened to me and will never happen again. Um, and then there've been, I'd say, a large number of doctors who are like, so hey, I heard you wrote this book, and it's a New York Times bestseller, and it's about like medicine and like fraud and whatever. And they're like, why the hell are people buying this book? Everyone knows this happens. Everyone knows this is going on. I'm like, okay, not everyone. So, so it's been mixed.
Okay. Are you ever scared for your life? Like you're going to go to a pharmaceutical convention and all of a sudden, two guys in a suit are going to be like, follow us.
Yeah, right. uh, no, but then now I'll be sure not to accept any invitations, but they're not really forthcoming anyway.
Are you still getting offers to speak out I mean, actually, I think your endorsement would be a very positive endorsement for any pharma company now because you've stated how ethical you are. So if your name is behind a certain drug, I think that would be a good thing. Pharmaceutical companies would say, "Hey, he's really honorable and ethical, so he's going to, his name is a huge stamp on the product because you've said in the book and, in interviews that you only endorse something that you really believe in."
Yeah. Yeah, well, I don't know. I mean, if they reach out to me and if I can present things the way I feel is fair and balanced, then yes. But most pharmaceutical companies, I mean, the reality is that they have their own corporate mission, and it's to sell drugs. It's to sell more and more drugs, and they don't want anyone presenting a fair and balanced view. They want someone who's going to champion their drug. That's the reality.
Um, are there still drugs now that you wholeheartedly endorse, regardless of the side effects?
Um, yeah, I mean, you have to keep side effects in view, but I mean, there are drugs that I believe are are very beneficial to patients. I believe that a lot of statin drugs are generally for the right patient group life saving. Like Lipitor and those drugs. Um,
That's the cholesterol drug, correct?
Cholesterol drug,
Yeah.
yeah. I mean, I don't think they should be put in the water like maybe pharmaceutical companies want, but I think they're generally very positive. I wouldn't have a problem endorsing a drug like that, partly because I take it myself. I know that what I need to keep healthy, and so I wouldn't have a problem with that. But all drugs, they have side effects, and you have to be smart about who you prescribe them to.
I'm more concerned, obviously you're talking about drugs for your health, which I don't have as much of an issue with. I'm concerned about some of these psychoactive drugs and drugs used in psychotherapy because I know so many people who have gotten just insanely addicted
Hmm.
to some of these psychosomatic drugs and and I don't I know some of them do have qualities, but it seems like every single day I'm hearing about another quote unquote, psychiatric disorder that I'm not sure is a disorder. Some kids
Yeah.
that obviously I'm not a doctor, but some kids that I genuinely do not have ADHD or are on Ritalin. I think that's some of that behavior is part of being a child. But
Yeah.
that I'm not a doctor, so
I totally agree with that, and I think a lot of psychiatrists agree with that. That kids are way, way over
over
medicated.
medicated, right?
Yeah. Oh
It's
yeah.
it's too much, and a
Yeah.
lot of times people are just brainwashed. I have a friend who's a doctor, and
Yeah.
he's so into the pharma world. I think, and he gets trips paid for and other things, which I thought was illegal, but I guess it's not.
Yeah. I know. I know.
And he's prescribing all these drugs, and it's kind of scary. So, I think to the listeners out there, do your due diligence and do what feels right, and make sure that you have a good doctor that's got your back, like you said, a good quarterback. So
Yes.
thank you so much for being on the show. And is there
Thank you.
anything else that you would like to talk about or tell people to where they can
No,
find you
it's
or anything else?
no, just I mean, just reach out to me, by email or Twitter or whatever, and I'd love for people to, at least take a look at the book and share some feedback.
Do you have a
And
follow-up book in the works?
no, not yet. Yeah.
We want to hear the third series to the book,
Okay. Okay.
medicine, how everything got fixed.
Okay. All right. All right.
A
Well,
solution. Okay. Well, thank
okay.
you so much for being a guest in the show. Guys, this has been Out of the Box Podcast with Rosie Tran. Out of the Box Podcast is sponsored by hugmetease.com. Spread love, give a hug, hugmetease.com. And guys, don't forget to go on iTunes and click on the subscribe button. We have a lot of subscribers and the numbers have been increasing. But if you've been listening for a couple weeks, couple episodes now, why not click on the subscribe button? It helps us out a lot and pushes our show up on the iTunes featured list and helps other people find out about the show. So that helps us out a lot. If you would like to support the show, you can go on outoftheboxpodcast.com and click on the support button. We are now accepting Litecoins, Bitcoins, and other alternative currency. And of course, as always, cold hard cash. Guys, this has been Out of the Box Podcast with Rosie Tran.